Okay, so talking about the medication order. So this is what it looks like in your book. This is what a doctor's order would look like here for the nurse in the nurse's station to keep in their chart if they're inpatient. If they're outpatient, then it's a whole different story. But first we're going to look at this, how an order needs to be written. So on an order, you do need the date and you do need the time. So these would be drugs that they would write for. So Axid, 150 milligrams by mouth twice a day. And there are these abbreviations in a chart later in this chapter. So the name of the drug needs to be placed. The amount of the drug needs to be placed with the proper unit of measurement, the route it needs to be taken by, and how often it needs to be taken. So as you can tell, all of these, so this is a potassium supplement, Cater, so 20 milliequivalents, so 20 and milliequivalents is going to be the amount, the units need to be dispensed. You can tell milliequivalents and milligrams are going to be two different things, by mouth 4 times a day. Then you have Colace, again, 100 milligrams by mouth at night. So there, as you can tell, there are things that have to be there. The name of the drug, so write this down. The name of the drug needs to be there. The amount of the drug with the proper unit of measurement, the route that it's going to be taken. So PO would be orally, or it'd be IV, which is intravenously, or it would be rectally, or it would be continuous infusion, whatever it may be, but it has to have a route and how often it needs to be taken. So these are going to be all the necessary things on there. Lastly, they need to have a signature. So the doctor has to sign their signature, and with most drugs, they have to put a DEA number, especially with narcotics, because with narcotics, those drugs are monitored very, very closely. And with the doctor's DEA number, they can monitor how often they're writing a prescription for a certain drug. So if we had Dr., let's say Woo, because you all know Woo, Dr. Woo is prescribing oxycodone for me, and then he prescribes it for Susan, and then he prescribes it for Marilyn, and then he and all of us are going in there just because we want pain meds, not for a particular reason. And he's just like, all right, go ahead, go ahead, go ahead, go ahead. Then his DEA number is going to ding, and he's going to be investigated of how he's giving the med, why he's giving it. Now, there are some doctors that do have to write a medication like oxycodone or something like that for multiple patients because they truly do need it. Maybe they're in a pain clinic, they will get dinged, they will get watched, and they're going to be asked why they're giving that drug out. And once they can see that and verify the reason why it's being given, then you're going to be okay. So this is the outpatient prescription. So on this prescription, a lot of them are now computerized, but the patient's name and the date, address of the patient and the age. I don't see this very much anymore. Anyways, and then right here, the prescription is going to be written. So again, what is it going to have? The name of the drug, the amount of the drug, the correct unit of the drug, how it needs to be taken, the route of administration, and then the amount of times it needs to be taken. So the pharmacy will always be giving the generic now, so they don't really check this box. They just have to do the generic. There's actually a box or a specification where they have to say it has to be the brand name. Generic just kind of comes now because it's a lot cheaper. And then how many refills are available, the signature, and here's that DEA number and the address of the physician. So that's the outpatient. So there's going to be things that you need to become familiar with. Military time. So the best way to remember how to do military time is to set your iPhone or your Android to military time, and you will not forget it. So 12 a.m. is where it starts. 12 a.m. or 2400 hours. And it goes 1 a.m., 2 a.m., 3, 4, 5, 6, 7, 8, 9, 10, 11 a.m., 12 p.m., and then it goes 1300, 1400, 1500, so that's 3 o'clock p.m. The reason why we do this type of time in the medical field is because if a doctor just writes, let's say that he just decides, okay, take 1 pill of whatever it is at 7 p.m. Okay, that's great, but what if he says take 1 pill at 7 and he leaves or she leaves? I don't know what time this 7 o'clock is. I don't know if it's in the morning or at night. So we are all required to work in military time. Okay, so there are different types of drug orders. So you have your routine order. And what this means is that the drug can, I cannot even speak today. I'm so sorry. A routine order, which means that the ordered drug is administered until a discontinuation order is written. A standing order, so I work with these all day long. So a doctor writes a list of things that a patient can have, and let's say that my patient says, I'm in a lot of pain. Well, I go to that doctor's orders and it will say pain, Tylenol, ibuprofen, oxycodone, I mean, you can't use those two, but Tylenol or ibuprofen, those would be examples of standing orders. So I can say, well, the doctor has a standing order, meaning I don't have to call him to ask if I can get this drug. I can actually just get it because it's already verified that it's an approved drug. And then a PRN order, so remember I talked about drugs being twice a day or 3 times a day or 4 times a day or every other hour. PRN orders, what they are is you will take it as needed. So Tylenol is a perfect example. I want to take Tylenol when I'm in pain. I'll take 500 milligrams of Tylenol, PRN, so as needed. And with PRN orders, you would say every 4 hours, PRN. So I can't take it more than every 4 hours, but I can take it every 4 hours as I need it. So those are the types of drug orders. So let me continue just a second.